Hello and welcome to our program Anxiety and Panic in Adults. My name is Lorena Diaz and today we'll be discussing understanding and managing anxiety and panic in adults. In this section, we'll also be introducing an intervention model designed for those who suffer in silence from daily stress. Many people lack the support or knowledge necessary to seek help and navigate the complex an often overwhelming process which personally I find deeply concerning. To guide this discussion, I am joined by an extraordinary team. Brianna Hernandez, Aldris Peña, Carlos Enrique Rodriguez, Kevin Smith, and Victoria Suarez. Together, we hope to provide valuable insight for adults facing anxiety and panic in their daily life or for those who may encounter those challenges at some point in the future. Let's get started. Anxiety disorders are some of the most common yet misunderstood mental health conditions in today's society. Encountered in primary care with generalized anxiety disorder and panic disorder affecting roughly 40 million adults or about 19.1% of total population by general 2021. Those disorders often go unnoticed or untreated, leaving individuals to struggle silently. The Diagnostic and Statistical Manual of Mental Disorder define generalized anxiety disorder as excessive worry that occur on most days for at least 6 months and causes significant distress or impairment. According to Journal 2021, generalized anxiety disorder alone affects 6% of the United States population in some instances during their life. Half of those people will not seek a diagnosis or treatment for this disorder until they experience it for at least 2 years or until the disorder has significantly disrupted their life. Although anxiety is a natural stress response, it is not just an occasional bout of stress, but a constant, chronic, or overwhelming anxiety that can lead to significant impairments in daily life functioning. In adults, it often manifests as persistent worry or fear, which may stem for concerns about finances, work, relationship, or social interactions. Panic disorder is another form of anxiety disorder that can strike without warning and it is characterized by sudden and recurrent panic attack. The Diagnostic and Statistical Manual of Mental Disorder defines panic disorder as recurrent panic attack that include characteristic symptoms and lack an obvious trigger. Imagine suddenly feeling as though you are losing control. Those panic attacks involve intense episodes of fear or discomfort, often accompanied by physical symptoms such as chest pain, shortness of breath, heart palpitation, dizziness, uncontrollable crying, and feeling of losing control. The severity of panic attack can lead individuals to avoid situations where attacks have previously occurred, which may result in agoraphobia or social isolation. For many people, this overwhelming fear leads to avoidance behavior, sometimes isolating individuals from friends, family, or everyday activity in an attempt to avoid another terrifying episode. Understanding what is happening in the mind of body of individuals during an, a panic attack or a day filled with endless worry is the first step toward recovery. Being aware of the natural generalized anxiety disorder and panic disorder is crucial for developing effective intervention and offering better solutions for those who suffer in silence, as those disorders significantly impact their quality of life, relationships, and overall well being. Addressing psychological and physical symptoms of anxiety disorders can help individuals regain control over their life, manage their symptoms, rebuild their relationships, and improve their mental health outcomes.
Hi everyone, my name is Victoria Suarez, and today I'll be discussing two key sections of our project: the literature review and our proposed approach to managing anxiety and panic disorder through self-efficacy interventions. This topic is very personal for me because I struggle with panic attacks myself. I've experienced firsthand how debilitating they can be, how they can disrupt daily life, make simple tasks feel overwhelming, and create a constant fear of the next attack. I take medication to help manage my anxiety, but I can attest that for the best results come when I combine both therapy and medication. Therapy, especially when it focuses on cognitive restructuring and gradual exposure to fears, has helped me regain a sense of control over my anxiety. Anxiety disorders are incredibly common, affecting about 18% of adults in the US each year. Unfortunately, many people suffer in silence, often avoiding treatment or feeling ashamed to seek help. Our research highlights the severe impact of untreated anxiety, which goes beyond mental health. Studies show that chronic anxiety is linked to serious health conditions, including cardiovascular disease, weakened immune function, and even higher risk of premature death. Anxiety affects everyone differently, but some groups are at a higher risk, including healthcare workers, first aid responders, and individuals with chronic illness. For example, people with chronic illnesses like diabetes or heart disease often experience heightened anxiety due to the stress of managing their health. These findings emphasize the importance of effective interventions that not only treat symptoms, but also empower individuals to take control of their anxiety. Key concepts in anxiety treatment. To create an effective intervention, we need to understand self-efficacy and the techniques that help individuals overcome anxiety and panic attacks. Number 1, self-efficacy and anxiety management. Self-efficacy is the belief in one's ability to manage challenges. Research has found that individuals with higher self-efficacy experience lower anxiety levels and use better coping mechanisms. On the other hand, low self-efficacy leads to avoidance behaviors, which reinforces anxiety over time. This is something I've personally experienced. When I avoid situations that trigger anxiety, it only makes my fear stronger the next time I encounter them. Number 2, fear ladders and exposure therapy. Fear ladders help individuals gradually expose themselves to feared situations in increasing levels of intensity. Exposure therapy is highly effective in treating panic disorders and anxiety, as it reduces avoidance behaviors and builds tolerance to anxiety-inducing situations. However, I know from experience that exposure therapy can feel overwhelming at first. Research confirms this. If it's not introduced gradually and with proper emotional support, it can actually increase anxiety instead of reducing it. Limitations of existing treatments. There are several common treatments for anxiety, but each has its limitations. Cognitive behavioral therapy, CBT, is the gold standard, but it requires long-term commitment, and people struggle to follow through. Medications like SSR and benzos can help manage symptoms, but they don't address avoidance behaviors and can lead to dependency. Lifestyle changes like exercise, better sleep, and reducing caffeine can help improve anxiety. But these changes require self-discipline, which can be hard for those with low self-efficiency. I know for me, therapy combined with medication has been the most effective approach because while medication helps stabilize symptoms, therapy teaches coping strategies that help me deal with long-term control over my anxiety. Given these challenges, our project focuses on self-efficiency interventions to help individuals develop the confidence and skills necessary to manage anxiety long-term. Our proposed approach. Our 12-week intervention program is designed to enhance self-efficiency by incorporating fear ladder exercises to gradually introduce anxiety-inducing situations, cognitive restructuring to replace negative thoughts while empowering beliefs, mindful and relaxation techniques to help improve emotional regulation, journaling and self-reflection to track progress and reinforce confidence. Research strongly supports self-efficiency-based interventions. Marina found that increasing self-efficiency helped trauma survivors reduce stress and tolerate anxiety-provoking situations. Arnella and Stefan showed the self-reassurance and self-efficiency trained significantly lowered stress and anxiety levels in caretakers. By the end of this program, we expect participants to experience fewer panic attacks and reduce daily anxiety levels, feel more confident in managing stress and triggers, adopt long-term coping strategies to maintain their mental health. In summary, our literature review highlights the prevalence and importance of anxiety disorders, the importance of self-efficiency, and the limitations of existing treatments. Our proposed interventions offer a structured, evidence-based approach to help individuals build confidence, reduce avoidance behaviors, and take control of their anxieties. Through self-efficiency enhancements, fear ladder exercise, and cognitive restructuring, we aim to provide a long-term solution for managing anxiety and panic disorders. Personally, I know how life-changing it can be to take small steps towards overcoming anxiety, and I truly believe that by using these techniques, individuals can regain control of their lives without fear of their anxiety controlling them. Thanks for listening.
Hello, this is Brianna Hernandez here, and as discussed in the literature review, the proposed approach for our intervention plan is to enhance self-efficacy among adults in order to properly manage anxiety and panic attacks. These studies discussed have demonstrated that individuals who display higher levels of self-efficacy tend to experience lower levels of anxiety and are able to employ better coping mechanisms when they are faced in stressful situations. Through this targeted intervention to enhance self-efficacy, these adults with anxiety are able to learn to manage their responses to stress, reduce the frequency of panic attacks, and improve their overall quality of life. The role of positive psychology in order to enhance self-efficacy is crucial by emphasizing the importance of strengths, optimistic attitude, and feelings of resilience against stressful situations. This intervention plan introduces the ideals of practicing gratitude, being able to view setbacks and challenges as incentives to foster growth or obtain essential life lessons throughout these experiences. The celebration of small successes for these individuals in hopes to decrease their disorders and enjoy long-term results for their mental health. During the intervention process, these participants are actively improving their regulation of emotions by being able to rewire their neural pathways which are involved with anxiety responses. This area or aspect of positive psychology is known as neuroplasticity, which is the brain's ability to properly categorize or form neural connections to certain emotions or thoughts that are evoked from learning and throughout experiences. During the intervention, the participants are actively engaging in certain tasks which would exhibit a reduced neural pathway in alignment with areas such as threat, stress, or reactivity in distressing situations.
Hi everyone, my name is Audrey Pena, and today we're going to discuss an important topic, managing anxiety and panic. Over the next few weeks, we'll explore strategies to help you gain control over your emotional experiences, develop confidence, and reframe anxious thoughts. I will guide you through weeks 1 through 4, which will introduce cognitive behavioral strategies to help you feel more in control of your anxiety. First, let's start by talking about the intervention program for enhancing self-efficacy to manage anxiety and panic. It aims to increase participants' belief in their ability to manage anxiety and panic attacks, thereby improving their overall well-being and emotional resilience. The program will last for 12 weeks, and participants will be adults aged 20 to 35 from various ethnic backgrounds who experience anxiety and panic disorders. Participants will be identified based on a survey conducted by the Department of Health and Wellness at 5 universities within the state of Florida. Anxiety and panic disorders have become more prevalent in recent years due to economic, political, and social pressures. Enhancing self-efficacy, an aspect of positive psychology, involves empowering individuals to believe they can successfully manage their anxiety and panic attacks through cognitive behavioral strategies, relaxation techniques, and gradual exposure to anxiety-inducing situations. First, let's talk about what anxiety and panic are. Anxiety is a natural response to stress, and panic attacks occur when that response becomes overwhelming. Our bodies enter flight or fight mode, leading to symptoms like rapid heartbeat, shortness of breath, and dizziness. While these reactions are normal, they can feel overwhelming if we don't understand them. One way to start managing anxiety is by recognizing our ability to control it. This is where self-efficacy comes in. Self-efficacy is the belief that you can handle anxiety-provoking situations. When we believe we can manage anxiety, its intensity often decreases. Now let's do a quick self-reflection. Think of a time when you successfully managed anxiety or a difficult emotion. It doesn't have to be something big. Maybe you calm yourself down before a presentation or manage to push through a stressful moment. Reflecting on these experiences can help boost your sense of competence. To deepen this self-awareness, take a few minutes to write down times you've overcome anxiety, even in small ways. This exercise helps reinforce the idea that you have control over your emotional response. The next step is setting small, achievable goals related to anxiety management. Goals should be simple and manageable. For example, you could set a goal like, I will practice breathing exercises for 3 minutes every day. And setting and achieving these small goals builds confidence and helps you realize that managing anxiety is possible. By the end of these 2 weeks, participants will have a foundational understanding of anxiety and panic. More importantly, they will begin to recognize their ability to manage anxiety through small, incremental successes. Now that we understand anxiety, let's move on to strategies that can help manage and challenge anxious thoughts. One of the most effective techniques is cognitive restructuring. This involves identifying and reframing negative, self-defeating thoughts. When we are anxious, we often have automatic negative thoughts like, I can't handle this, or I will never get better. But we can challenge these thoughts by replacing them with more balanced ones, such as, I have faced anxiety before and managed it. I can do this again. The exercise we'll be doing for this will be a thought replacement. Take a moment to think of a recent anxious thought you had. Now reframe it into a more positive and realistic statement. For example, if your thought was, I'll fail this presentation, try replacing it with, I've prepared for this and I can do my best. This practice helps shift our perspective and reduce anxiety over time. To further reinforce this practice, we encourage keeping a thought record. In this journal, write down anxious thoughts, examine the evidence for and against them, and replace them with more balanced alternatives. Over time, this helps weaken negative thought patterns. Building confidence in managing anxiety requires practice. This is not something that you can do overnight. Patience and practice are key. One way to do this is do this through mastery experiences, gradual exposure to anxiety-provoking situations. Now we will be creating what I like to call a fear ladder. A fear ladder is a tool that when you start with a less intimidating challenge and gradually work your way up to a more difficult situation. For example, if social anxiety is an issue, you might start by making small talk with a cashier before progressing to a larger social interaction. By taking small steps and gradually increasing exposure, participants build confidence in their ability to handle anxiety-provoking situations. At the end of these weeks, participants will have learned to challenge negative beliefs and replace them with empowering ones. They will also gain confidence from successful cognitive restructuring and exposure to anxiety-inducing tasks. Managing anxiety takes time and practice, but with awareness, self-reflection, and cognitive strategies, it is absolutely possible. Remember, small victories lead to big changes. Start by recognizing your past successes, setting achievable goals, and challenging negative thoughts. The more you practice, the stronger your ability to handle anxiety becomes. Thank you for listening.
Hello everyone, my name is Carlos Rodriguez, and over my portion of the project, we will be focusing on equipping you with effective strategies to manage anxiety and panic. Anxiety can manifest itself in many ways: racing thoughts, muscle tension, and rapid breathing. However, by learning how to control these responses, we can develop a sense of calm and confidence in handling stressful situations. Throughout weeks 5 and 6, we talk about relaxation techniques. Relaxation techniques are powerful tools to manage psychological symptoms of anxiety. Research shows that these techniques can significantly reduce the severity and frequency of panic attacks. One of the techniques we'll practice is progressive muscle relaxation, also known as PMR. This involves tensing and relaxing different muscle groups, helping to release physical tension. Studies dating back into Jacobson in 1938 confirmed that PMR is highly effective in reducing stress and enhancing emotional regulation. We'll also work on breathing exercises, specifically the 4-7-8 method, and box breathing. Controlled breathing helps activate the parasympathetic nervous system, which signals the body to relax. Learning how to breathe properly in moments of stress can significantly reduce panic symptoms. Another tool is visualization techniques. Guiding imagery allows you to mentally rehearse handling anxiety-provoking situations with confidence. Research has shown that visualization strengthens self-efficacy and helps manage stress. By the end of these 2 weeks, you should feel more in control of your anxiety symptom experience and reduce in panic attack severity. And finally, it will build confidence in your ability to manage stress throughout relaxation techniques. In weeks 7 and 8, we ensure that self-reflection. Avoidance often makes anxiety worse. The more we avoid fear, the more powerful it becomes. Exposure therapy is one of the most effective ways to break that cycle. You see, we'll begin in the gradual exposure. When you first create a fear of hierarchy, ranking anxiety inducing situations from least to most stressful. Facing these fears in a collective way has been proven to reduce avoidance behaviors and increasing confidence. In addition to exposure, self-reflection is crucial. You will document 3 instances on where you successfully applied coping techniques. Research suggests that self-reflection strengthens emotional resilience and builds self-efficacy. Finally, we will incorporate peer support through success story sharing. Hearing other experiences and discussing your own progressively can provide encouragement and motivation. Studies have shown that social support significantly enhances anxiety treatment outcomes. By the end of this program, you'll have a stronger sense of confidence in managing anxiety, a reduction in avoidance behaviors, and the skill to face real-life stressor effectively. Anxiety doesn't have to control your life, but with these techniques, you can take back the control, build resilience, and develop long-term strategies for emotional well-being. I look forward to working with you guys in this journey, and I thank you for paying attention throughout this part. Thank you.
Kevin Smith, and in this video I'm going to be detailing the contributions that I made to our wiki project on anxiety and panic in adults. So, I first started out in the introduction. I mainly supplied various stats that pertain to certain disorders like anxiety disorder and panic disorder, and just really showing just how much these disorders affect our general public, to really emphasize the importance of receiving treatment, being diagnosed first, and then receiving treatment to help combat the effects that these disorders can cause. Next, I jumped to the literature review, and basically I gave a little bit of an explanation of what self-efficacy is and how it can help combat the effects that these disorders can cause, anxiety and panic disorder, really showing that when someone is confident in their beliefs, it really helps them overcome the effects that these disorders can cause. I also gave a detailed explanation of what exposure therapy is, basically explaining how this behavioral therapy, this cognitive behavioral therapy, can really do wonders for people who are trying to overcome these effects, or maybe are trying to find a way that works for them. So this exercise can really help them find that method that will mostly help them overcome the effects of their certain disorder. To my contributions that I made to the introduction and the literature review, I was then tasked with handling week 9 through 10, as well as 11 through 12 in the intervention stage. So with 9 and 10, week 9 and 10, it's the enhancing coping skills and problem solving. Basically, we're trying to find effective strategies that will help participants bridge the gap to finding a effective strategy to help them cope with the effects that their disorder might cause for them. So one thing that we did emphasize is the method of exposure therapy, basically role playing. We'll put them through a exercise that basically allows them to live out the triggering experience that causes these effects to happen. And by them going through these over and over again, they start to realize that they have the tools necessary to not be affected by these disorders. And by doing so, they build necessary coping strategies that will hopefully, over time, enable them to not feel these effects anymore, while also building self-efficacy, which will really help them manage the challenges that come with panic and anxiety disorders. Then moving on to week 11 and 12, which is preparing for long-term success and relapse prevention. Basically, it's in the title. We devised a plan that will help them have long-term success when it comes to battling these disorders and the effects that they cause, and making sure that once they overcome this disorder, whichever disorder they have, that they don't revert back to their susceptible ways, which put them in positions to be affected by these disorders. First thing we did was really go over some of the techniques that we used in the beginning of our study to really enforce and build a good foundation to help them get through these disorders. So we give them like a reflection plan and show them their progress and show them that, look, you really did this and this can really, help you in the future. And this really helps them not only to see that they've done great things, but also that you won't relapse as long as you continue to follow the plan that we laid out here. It really gives the participants confidence moving forward to see their self-efficacy and see their abilities grow and to continue to grow as long as they, stay the course. Other than that, that's basically my contributions to our wiki project.
Again, this is Brianna Hernandez here to cover the rationale of this intervention program laid out above. This intervention program to enhance self-efficacy in order to manage anxiety and panic attacks among adults offers a methodical research-based approach to treat adults with generalized anxiety and panic disorder. The outcomes applied in this approach are able to help individuals regain control over their anxieties by gradually boosting their self-efficacy levels, which enhances overall mental health and general well-being. In this intervention, the Panic Disorder Severity Scale, the Self-Efficacy Scale, and the Generalized Anxiety Disorder Scale, GAD-7, were all utilized to accurately track and measure the participants' progress as they accelerated through the intervention program. In addition to these quantitative measurements and data, the researchers also found it important to include qualitative measures by collecting journal entries and self-reflections from the participants. They also thought it was beneficial to record group conversations to provide a personal insight for each individual participant's development throughout the 12-week intervention. The researchers also made it important and applied an area for alterations or adjustments for the individual participants and for them to meet their successful goals around the midway point between weeks 6 and 7. In our intervention, we displayed and expected certain outcomes from each individual. By the time the participants have reached the end, they're expected to have experienced a significant decrease in daily panic attacks or heightened levels of daily anxiety, an increased level of self-efficacy, and the belief of themselves to properly manage anxiety-inducing situations and episodes of panic independently on their own. Enhanced coping skills, practices of relaxation, problem-solving skills, and emotional regulation strategies should all be integrated by the end of the 12-week intervention. Increased resilience and preparedness for managing future anxiety and panic attacks, and the ability to handle stress without a loss of control. Greater overall well-being and a reduced sense of helplessness when facing anxiety-inducing situations, and the goal is for the participants to have the confidence to navigate different relationships, professional tasks, and all of their daily responsibilities independently. The continued implementation of mindfulness, journaling, and exposure to techniques beyond the completion of the intervention period was the main goal of the researchers in order to benefit the participants. Overall, this intervention program for enhancing self-efficacy aligns with the hypothesis that explains that adults who actively participate will experience a significant decrease in the symptoms of their anxiety while also obtaining the self-confidence and mental health status independently outside of the intervention. The researchers were able to do this by integrating an evidence-based strategy, fostering self-awareness from themselves and their participants, promoting enhanced self-efficacy levels, and the program outlines foundational process to sustain improvements of these adults' mental health. Thank you.